I'm working on a dream. Tuesdays with Dr. T on the Wake Up program.
Dr. T, the dream has come true.
The dream, sometimes it feels so far away. That's for Robert down in Laurinburg.
Yeah, but one dream has come true, Dr. T. And that's what we're going to talk about today.
Dr. Nelson alongside Pastor Dennis Shepard on the Wake Up program, WIDU Studios, along with Chuck the Engineer and Don Garner Productions producing our TV show. You can catch the show on Time Warner Cable Channel 60 every night from 7:30, 8, and 8:30. 3 showings and overnight as well at like 2 in the morning. You can go to 1080 on demand and check out the shows as well. We've got all the high school football games from last year on demand as well on Time Warner Channel 60. Or you can watch us on streaming live on www.widuradio.com every Tuesday, or tune in on the radio show. And also, we should mention WAGR down in Laurinburg as well. Okay, good morning, everybody. Pastor Dennis Shepard at Hope Mills United Methodist Church, home of the dry dam.
But we're working on it.
We're working on a dream. Someday the dam shall be filled with water.
Exactly.
The lake shall be filled with water, and the dam shall be secured.
Right. We're working on it, and I think it's going to happen.
Any latest update on that scenario, on that situation?
They are, as I understand it, they are in negotiations now with the contract stuff. So should be happening soon, I would hope.
Isn't that a
maybe
perfect
when the weather
example?
gets warm? Maybe when the weather gets warm, they can start working.
Honestly, we can't even fix a dam in this country. Is it really amazing, isn't it?
Yes.
When government gets involved and local, state government can. How long has it been dry? The lake out in Hope Mills?
Last time it went dry was 2009.
2009,
So
but it was before that was 5 years, right?
2003, and they put water back in it, and it was open in 2008.
So it was how many months?
18 months, about 18 months, yeah.
So honestly, I mean, 2003, it's 2015 now, 12 years that they've had issues with the dam out in
Oh,
Hope
absolutely.
Mills. Okay, today's subject is chiropractic. I don't get a chance that often. I don't want to bore you with chiropractic, but I think it's important because I don't know if you've heard my latest radio spot that the VA, Veterans Administration, now covers chiropractic.
Absolutely.
So we're seeing more and more soldiers, veterans, come into the clinic, and I want to make sure that people understand what the benefit is and how do they get the benefit, and what is the benefit of the benefit. But chiropractic has. There was a research study conducted by the Department of Defense, and I think the study went on for about 7 years. And chiropractors worked in different military bases.
Right.
And this went on for a number of years until finally there was the study concluded, and they concluded that absolutely chiropractic was beneficial to soldiers. The Department of Defense chose to put chiropractors in some military bases and then offer benefits, but only to veterans, which I think they're working on TRICARE, but currently TRICARE does not cover chiropractic. So the active soldier does not have benefit. He can see a chiropractor on base, but your veteran has chiropractic benefits.
Yes, sir. In 2002, President George Bush signed Public Law 107-135, legislation that ensured that chiropractic care would become a permanent benefit for the recipients of veterans' health care services.
Yeah, absolutely. And only up until recently have soldiers, retired soldiers, taken advantage of that benefit. So today's program,
a lot of them didn't know it, Dr. T.
They didn't know it, and that's one of the reasons I did the radio spot, because a lot of veterans didn't know it. And now with the VA so busy because of all the returning soldiers, back pain, neck pain, and headaches and musculoskeletal pain are right up the alley of the chiropractic profession, especially with the benefit of not utilizing any medication or drugs. Chiropractors do not prescribe medication. It's not within our scope of practice. Chiropractors, however, do therapy and chiropractic spinal manipulation, joint manipulation, mobilization, with the use of varying physical modalities. And this is extremely beneficial to our soldiers who are suffering from musculoskeletal injuries.
Yeah.
And we've seen recently, I'd say within the last 6 months, an uptake in the amount of patients coming in from veterans that are coming in for chiropractic, which has been really, truly, it's an honor to treat the soldiers, and it really is great to see them progress.
Right.
And a lot of times when we do get to see the patients, they are, they've been through a series of different types of care.
Right.
A lot of them have already been through the VA system. A lot of them have been to medical doctors, been to orthopedic, had MRIs, CAT scans, X-rays, have taken a series of medications, have had injections, have gone through physical therapy. So, what's different in the chiropractor's office? What's different is the chiropractic adjustment, manipulation, spinal manipulation, joint manipulation. And of course, even in this day and age, in 2015, it's hard to understand why this is not something that is common knowledge to a lot of patients. So people still do not understand what chiropractic is all about. So it's probably my job and the job of chiropractors to explain to as many people as possible is what is chiropractic and what is spinal manipulation. Patients don't know this, but you had your own experience.
Yes.
And why don't you tell everybody what you were diagnosed with a disc?
Yeah, 1 year ago, I threw my back out trying to lift an old heavy television. I ended up in the ER where I was diagnosed with possibly herniated disc and was given a shot of a medication called Dilaudid that put me in outer orbit. I did not want to get addicted to the pain pills. I knew better than that, so I went to Nelson Chiropractic. The doctors gave me an evaluation on my back, took x-rays, and began immediately to treat me. I was put on a flex bed, which moves the spine. I was given stems, and the ultrasound therapy. Yes, that's right. And then as it began to get better, and by the way, I told my own physician I did not want to be on pain pill, so he graduated me off of those down to a Aleve, which is an over-the-counter
med.
Yeah, right, NSAID, and with chiropractic treatment, in 4 weeks' time, my pain was completely gone. I was back to a normal life.
And you were, you were bent over. I mean, you couldn't.
I had to lay on the floor with my legs up on the couch.
That's right.
It was the only way I could get any relief.
Right. So you couldn't stand upright. You were in a bent over hunch position. You couldn't move. There was an acute back spasm.
Yes.
And, the adjustment is the mobilization of the vertebral segments, and that's what I wanted people to understand. In between the joints in your body are fluid and air, and sometimes those vertebral segments that are from the base of your skull to the lower part of your back, those joints are movable. That's how we get our flexibility. That's how we're able to function. And when you're injured or you go into acute spastic state where you're bending over, you're twisting, you're picking up a box, you're not paying attention, you don't bend at the legs, you've got a full-blown low back episode, the disc inflames, which is between the two vertebrae. What can you do to affect that segment? And I don't know anything beyond chiropractic that could help that segment. Now, people will say, well, you could just lay on your back for 2 months and it'll go away. The inflammation and the spasm may subside, but beyond that, to affect the vertebra, the vertebral segments and the joint and the disc, the only thing to reestablish that is motion. In other words, you want to return to normal motion.
Right, yeah.
So getting in there and adjusting the vertebral segments, actually moving the vertebral segments, and getting functional movement into that joint by traction and distraction and then manual manipulation, that's what gets the vertebral segment better. And that's what helps the muscles to relax. That's what helps the tissues to begin to heal. That's what helps the inflammation to go down and the motion to restore the joint motion into that segment. That's the difference between chiropractic and physical therapy. That's the difference between chiropractic and general medicine. That's the difference between chiropractic and any other profession. The difference is the chiropractor adjusts or manipulates the segments. And that's really the only thing, one of the main differences between what we do and what anybody else does. So that's getting to the root of the problem.
Right.
And when it comes to our soldiers, you got to remember, a lot of these soldiers have spent years, jumping out of planes, have spent years serving the military. Maybe they were in supplies, maybe they were in infantry, heavy artillery.
Right.
I mean, their bodies are taking a pounding.
Paratroopers.
That's number
right.
one.
Yeah.
So the 206 bones in your body, the articulations of these joints, and the slow degenerative process that occurs over a 25-year period of service, those joints are not in healthy condition to begin with.
No, they're not.
And most of the time, this is what's interesting, most of the time, we're not seeing, the soldier that just got out of the military.
Yeah.
We're seeing the soldier who's been out for a couple of years, who's been out for 15 years or 20 years, and has had suffering from pain, for 10, 15, 20 years.
Yeah, without any relief.
Right. The idea that we could even help that person when they've been to every single provider under the sun, and they've had every single diagnostic study under the sun, the fact that we could possibly help that person is really a miracle in itself, that they can get any sort of relief from chiropractic. So look, when you're acute and the injury just occurs, there's nothing better than chiropractic. Everybody now knows that if you're involved in an accident and you have acute pain, chiropractic helps. And the immediate introduction of chiropractic helps. That's why I say your first stop following a car accident, right? You're going to sprain strain to your neck or back. Immediately applying chiropractic care helps you to heal. The younger you are, the quicker you render care, the safer you're going to be, the better you're going to be out of pain. But even in chronic conditions, like the soldiers that are now coming to us, I mean, you wouldn't believe the cases. I mean, you do a history and someone's on 15 different medications. They've been on it for the last 10 years. Every day of their life.
Yes, sir.
And they have, and here's the question I ask. How do you feel? I mean, it's one thing to take all these medications. It's another thing to feel how horrible. It doesn't make any sense.
Your quality of life is diminished, Dr. T.
But shouldn't you feel better if you're taking all these pills?
You should. The whole idea is but the problem is, in medical science today, it's primarily about pain management. We have concluded that if we can manage the pain, people can have a reasonably normal life.
Well,
that's not true.
Well, we've got a huge problem in our country with regards to medications. I mean,
absolutely.
I mean, you talk about a drug-free society. I mean, it's out of control.
It is.
We've got patients that are on multiple medications, and a lot of times they don't know how those medications are interacting with each other. And they're wondering why these other symptoms, are popping up that they never suffered from before. It's a mess. So the reliance on pills, especially for musculoskeletal pain, long term is not the solution.
No.
Long term, it is not the solution, and it aggravates me, not with regards to the VA, because I am so thankful that we're starting to get those referrals, but in general insurance, where we're having this discussion about health care and about lowering cost. It's ridiculous that the number one carrier in North Carolina, and Blue Cross and Blue Shield is no surprise, does not promote, does not endorse, does not really include, and does not expand chiropractic benefits. We've seen in the last 20 years the diminished access to chiropractic through general health plans. With Medicare, Medicaid, same thing. This should be at the top of the list. I just read an article in AARP that came out for the October, November. I think it comes out every other month. But the article talks about, in the middle, should you have surgery abroad, and how more and more Americans are choosing to leave the United States because of the huge cost to surgery. And at the top of the list here, you've got spinal fusion at $45,000. Hip replacement, $33,000.
On a mean average, yes.
Hip resurfacing, $47,000. Knee replacement, $34,000. Neck surgery, $50,000. I mean, it's incredible that, and I'm not saying that sometimes people don't need these surgeries, but let's try a little prevention. What's wrong with trying, a plan of prevention so that we don't get into this situation where people aren't leaving the country and going to Costa Rica or Hungary or India or Malaysia or Mexico, Poland, Singapore, Thailand, UK, to have these surgeries. I mean, this is quite an interesting article, and what really drives me crazy is the article is like, the insurance companies are so wonderful that they're actually sending people out of the country, and they're covering the expense because it's cheaper to send somebody to the UK for back surgery than it is in the United States. It's insane.
It is insane.
If they just included chiropractic and expanded on the benefits and lowered the copays to our profession and lowered the deductibles and opened up the doors to those patients, there would be a dramatic drop in the amount of patients that are suffering from chronic disease. I'm completely convinced of that.
Dr. T, I ran across some interesting facts here in my research. This is from an article about the VA offering chiropractic care, and the writer here documents that a patient receiving regular chiropractic care experiences reduced hospital admissions, surgeries, and pharmaceutical costs. Studies indicate that greater chiropractic coverage, despite increased visits to a DC, doctor of chiropractic, results in significant net savings in both indirect and direct costs. Chiropractic care could reduce Medicare costs, both payment for all services and average per claim payment. Chiropractic patients typically pay less and are more satisfied with their treatment than most MD patients. Chiropractic care can be used to control healthcare costs. Chiropractic patients reach maximum medical improvement sooner than when treated by a medical doctor. Chiropractic treatment is not an add-on. It is a direct substitution for other treatment. And I just want to say to folks who've never been to a chiropractor, because I've been asked this question by people, it does not hurt. It's not painful. You don't get injections. You don't get all that stuff. Right. And even if they do a cold laser or do the ultrasound, you don't feel it. It does not hurt. It's painless.
The biggest fear is probably the joint manipulation. What is the sound, the cracking sound when you adjust the vertebra?
Right.
And the explanation is that the surface in between the joints, it's like a suction cup, and there's fluid and air in there. And just like you would move, have you ever moved in bed and your hip is popped, or you're walking and your knee pops, or your back pops, and actually you feel some sort of relief.
Oh yeah.
As if your body knew innately that something was stuck, and then it was unstuck, and it kind of relieved itself. Well, your joints have to articulate. They have to articulate throughout your life, in order to function.
Right.
And the things that we do that affect those vertebral segments or the joint segments throughout our body, our shoulder, our knees, our elbows, our ankles, our hips, that interferes with the normal joint articulation. So when you feel that relief, that's what causes that relief of pain, because there's a normal articulation to the vertebral segments and to the joints in your body. So that's what chiropractic is. When you adjust the segment, you get in there and adjust the joint, which is often called a subluxated vertebral segment, when the joint is out of alignment, adjusting it causes some sort of relief and normal articulation. And how do we know this? Because somebody comes in, they can't turn their neck, they can't turn their head, they can't move their neck to side, they can't flex their trunk without low back pain, they can't rotate their trunk without mid-back thoracic pain. We adjust the segments, we work on the tissues that attach to those vertebral segments, and there's a restoration of the joint motion, and then there's a relief of pain. So when you're talking about joint manipulation or adjusting, that's what it is. There's nothing to be afraid of. People have often said to me, well, cracking your knuckles, is that bad? It's not bad as long as it's not something you do every 3 seconds. I mean, you can stretch out your body, and there's a natural, you'll hear a movement of the joints.
Right.
It's no different. Stretching is no different than when you feel that pop and you stretch. It's no different than the adjustment. The adjustment's more specific. Certainly, you can't adjust, T6 in the middle of your back. There's no self-adjustment for that, or L2 in your lumbar spine. There has to be somebody that applies the right force at the right motion at the right directive to adjust that vertebral segment. And chiropractors, that's what we study. I mean, that's what we study in school. We study every possible joint in the human body. We study every nook and cranny, spinal anatomy and peripheral anatomy, and we study, gross anatomy to make sure that we understand how to adjust the segments specifically for the patient that we're seeing. So when it comes to VA soldiers suffering from neck and back pain, or shoulder pain, or knee pain, or hip pain, ankle pain, chiropractic is effective, and it gets the person moving again. It gets their body moving again. It gets their muscles to relax. It gets their body functioning. On a regular basis, I see people that, have pain sleeping. I mean, I can't sleep. You touch them and they have pain, and they're like, oh, don't touch me there. I said, well, so I can't touch your back? It's that bad to the point where you can't even touch their back? How do they function in life? I mean, how does their spouse doesn't touch them? I mean, their spouse doesn't touch them. They avoid their back? So that's abnormal. I mean, if you can't be touched and it's too painful, that's a signal that there's something going on. And right now, one of the things, if I can, speak to some of the doctors at the VA, we're seeing referrals, but we're seeing them, in 8 or 9 increments of visits. And the problem is, you have somebody that's been suffering for 15, 20 years of pain. A week of care is nothing. It's a drop in the bucket.
Right.
A week of care is nothing. 4 to 6 weeks of care is nothing. When it comes to the amount of expense that's already been expensed on this patient. So just to get through the muscle tissue and the irritation and get the body to relax, that takes about 2 or 3 weeks. When you've been through a patient that, you touch their back and it's like as hard as this table. I mean, some patients, you could bounce a quarter off their back. It's like a snare drum. That's how fibrotic the tissues have become.
Yeah.
You know, think of cowhide.
Yeah.
Right? You know, there's no blood vessels passing through cowhide. That's why it makes it so strong, right?
Yeah.
When they kill a cow, they take the hide and they beat the hide. All the blood comes out of it and becomes this real tough tissue.
Right.
The muscle belly in your body become fibrotic when there is not blood rushing through the muscle tissue. When the muscle tissue isn't healthy, it becomes fibrotic and it becomes taut and tender, and you can't get through. Very painful to get through that muscle belly to get to that vertebral segment. So I tell patients all the time, look, it's going to take a week or two to get things moving here.
Yep.
You know, but the good news is, if you hang in there with me, we'll make some real changes. We'll get to the point where maybe you're out of pain and maybe you're functional again. You know, you've been suffering for 15 to 20 years. What do you have to lose?
Right.
Right. You've taken every shot. You've taken every pill under the sun. You've been through every therapist. You've had every CAT scan and MRI. What's there to lose? Right. It's just about your time and our treatment trying to get through to your body and get that body moving again. I'm Dr. Nelson. We're talking about chiropractic. The VA now covers chiropractic. We'll talk about how do you get that referral, what do you have to do to be referred to a chiropractor, and we'll discuss some more about our profession. It's Tuesday morning with Dr. T, Wake Up program. We'll be right back. I'm Dr. Nelson. We'll be right back. Tuesdays with Dr. T along with Pastor Dennis Shepard. We'll be right back.
Right back.
Nelson & Nelson Chiropractic Center, serving Cumberland, Lee, and Robeson County, including the greater Cape Fear Valley region. All with no waiting, minimal paperwork, advanced treatment techniques, and expert doctors and staff committed to providing the very best in chiropractic care. Voted #1 chiropractors in the Fayetteville Observer's Reader's Choice Award. Nelson & Nelson Chiropractic Center, committed to our profession, our community, and putting our patients first.
You know, we're telling you, you have to participate in your treatment. You have to come in, you know, give us 30, 40 minutes a day to work on you, or 25 minutes a day to work on your back or work on your neck to try and reestablish joint motion and get your body moving again. So there are no quick fixes, and there's nothing really, I don't know what the quick fix is to any aspect of life, but chiropractic is effective. It has been accepted by the Department of Defense. It is now in the veterans' budget, the VA. The benefits are there for our veterans. So if you're suffering from neck or back pain or musculoskeletal pain, you know, let's say you've got sciatic pain, pain down your leg. You've had that for the last 5 years. Or let's say you've got thoracic outlet syndrome. Or let's say you've got numbness and pins and needles sensation into your hand that's unexplained. Or let's say that you have degenerative disc disease of the lumbar spine. Or let's say that you've had hip problems since the incident that occurred in Iraq or Afghanistan. If you're suffering from these things, you know, the benefits are there. Ask your VA doctor for the referral. He'll give you the information, the form, and you'll be able to see any chiropractor of your choice. I think we're all on the list. We're not the only clinic on the list. I think most of the chiropractors in town are on the list.
Right. All right.
So it's a great benefit, and
We need to take a break.
And we need to take a break. We need to take advantage of what's available to us at the VA. I'm Dr. Nelson. We're talking about chiropractic and the Veterans Administration benefits for all our fine retired soldiers, and we'll be right back after these messages. I'm Dr. Nelson. We'll be right back. Tuesdays with Dr. T along with Pastor Dennis Shepard. We'll be right back.
Right back.
Buenos días, mi nombre es Alma y trabajo en Nelson & Nelson Quiropráctico y quiero presentarles a la señora Martínez.
Mi nombre es Tania Martínez, soy una paciente de Nelson & Nelson Chiropractic Center. Me dolía la espalda y el cuello, ahora yo me siento bien gracias a Nelson & Nelson Chiropractic Center, se lo recomiendo.
Gracias, señora Martínez. 1, 2, 3. Nelson & Nelson Centro Quiropráctico. Cuidamos por ti. What do we do to our body that affects, this change, right? We play sports in our youth. We work in our midlife. We get less physical as we get older.
Right.
And that slow degeneration, the slow progressive changes is what changes the vertebral segments in the joints. The only thing that sustains life is what? Is motion.
Right.
Motion. That's the basis behind chiropractic. Establishing motion into the joints, getting the body flexible, you know. When we take somebody who suffered from pain for years, we don't just tell them, look, we're here for you for 4 to 6 weeks or 8 weeks. We're here for you as long as you want to feel good. You know, the basis behind chiropractic is maintaining your body throughout your life and hopefully maintaining your ability to avoid some of these problems as you get older. And the slow progressive change of your body has to do with what you've done throughout your life. It's cumulative stress, you know, multiplied by 70, 6 years of life.
Right, absolutely.
You know, if I took your finger, Pastor Shepherd, and I was to tape it in this position, and I leave it in this position, I have you can't see me on the radio, but I have my finger flexed, right?
Yeah.
And I tape it and I leave it like that for
Yeah.
the next, 6 months. And I don't move it. What's going to happen to those joints?
It's going to freeze in that position.
And those joints are slowly going to die. Same thing as
Right.
if you cast an arm, right? When you
Yeah.
take the cast off, you can barely flex your arm. The reason for it is because you've got a slow, accelerated degenerative changes that occur over time. So the joints start to wither and they start to break down.
Yeah.
The only way to fight against that is motion, mobility,
Right.
adjustment, chiropractic. Ideally,
And muscles will atrophy too, Doc,
and muscles
if you don't
will
have-
atrophy.
If you don't have much motion.
and the muscle will die as well. So
Right.
keeping your body flexible. Here's a great health plan for you. You want a great health plan? Here's what you do. You get yourself a chiropractor, and massage therapist, and acupuncturist, and nutritionist, right? And an MD that understands holistic healing. And you go to a facility each and every day where you can get relaxed and have less stress in your life and get adjusted and sit in a relaxation room and listen to nice, inviting music
Right.
and try and get your body to relax and heal itself and maintain through a healthy diet and massage the muscles and keep your body in a state of what we call homeostasis, right? That is the way to stay healthy. That is the way. That is the new way to stay healthy.
Right.
Unfortunately, we can't keep popping pills in this country, and we can't function. Right? We can't keep this up. This epidemic, I call it, in this country, where everyone's on medication, and we're starting to, pump kids full of pills. It's got to end at some point. We just can't keep it up.
Sure does, Doc.
Okay, remember, if you are a veteran suffering from neck pain, back pain, musculoskeletal pain, neuromusculoskeletal pain, try chiropractic. See your VA doctor and ask them for a referral for your local chiropractor. I'm Dr. Nelson, another segment of the Wake Up Show, along with Pastor Dennis Shepherd. Pastor Shepherd, yesterday's a canceled check.
Tomorrow is a promissory note, Doc.
Today is the only time we have.
That's right.
So spend it wisely. God bless. We'll see you next Tuesday.
God bless everybody.
I'm